In this fast-changing world, where both population and technology are growing steadily, almost two-thirds of the world still doesn't have access to high-end eye care technology. Rajan Eye Care aims to bridge this gap by providing world-class eye care. Brewing together science and technology since 1995, Professor Dr. N. Rajan, the founder and visionary leader, has metamorphosed a once modest clinic into one of India's super specialty eye hospitals and a postgraduate institute of ophthalmology. Rajan Eye Care has emerged as a pioneer in creating world-class eye care through trust, experience and state-of-the-art infrastructure. Dr. Mohan Rajan is the Chairman Medical Director and eminent ophthalmic surgeon in anterior and posterior segment surgeries, specialist in phacoemulsification, foldable IOLs and vitreous surgeries. He has created a benchmark by serving people in all socio-economic backgrounds for total eye care in the field of community ophthalmology.
India has a population of 1.3 billion, out of which 25 million people are blind. Another 25 million people are visually impaired. Keeping this objective in mind, Rajan Eye Care Hospital was started in 1995 with the main purpose of providing world-class eye care and performing the most complicated eye surgeries you can ever see. And today, after 22 years, Rajan Eye Care Hospital has become a super specialty eye hospital and a postgraduate institute of ophthalmology.
Rajan Eye Care tries to bring its service within the reach of every individual and has established branches in various locations across Chennai, which includes T Nagar, Adyar and Velachery. Dr. Sujata Mohan is the Associate Medical Director and a specialist in anterior segment surgeries. Her commitment towards the profession has made a tremendous growth for the hospital. Integrating with well-trained and skillful medical professionals, Rajan Eye Care has left no stone unturned when it comes to holistic eye care. Refractive Surgery Clinic. LASIK is currently the most sophisticated refractive procedure for correction of refractive errors. The hospital has installed a 4th generation laser capable of treating myopia, short sight, hyperopia, long sight, and astigmatism, cylindrical error. For refractive error of higher degree, LASIK laser provides very good results.
Refractive surgery is one of the most commonly performed surgery in the human body. It's popularly known as LASIK and provides freedom from glasses and contact lens. It corrects refractive errors such as myopia, hyperopia and astigmatism. LASIK is an ambulatory procedure and the patient is able to walk in and walk out and regain normal vision in just a few hours. The technology that we have in Rajan Eye Care is perhaps one of the best in the world. We have what is called as a bladeless laser technology, in which the femto laser creates a flap and the examer laser actually does the ablation or correction of refractive errors. Till date, we have completed more than 50,000 refractive procedures with excellent results.
The state-of-art modernized theatre is a stainless steel with HEPA filters, which captures and eliminates microorganisms, not allowing a single microbe to come into the surgical field, which helps in delivering a very safe anesthesia for a 1-day-old kid to a 100-year-old young patients.
Squint and Ortho-Optic Clinic. Correction of squint and ocular motility disorders.
We at Rajan Eye Care are one of the centers of excellence for orbital and oculoplastic surgery in the country today. We do a wide variety of oculoplastic, orbital and cosmetic surgeries, where we cater to a wide variety of patients with special needs. We also have a specialized Botox clinic and thyroiditis clinic where we cater to patients with cosmetic needs and problems due to thyroid eye disease.
Cataract Specialty Clinic, Intraocular Lens, IOL Implantation, Small Incision, Sutureless Cataract Surgery, Phacoemulsification with Foldable IOL.
Cataract surgery has grown leaps and beyond expectation, and the quality we need to give to the patient is equally important. Hence, we have a specialized post-operative clinic at Rajan Eye Care, which takes care of the patient with that extra professional touch to make it much more easy for our patients. A patient is the most important person in our premises. We understand that we deal with the most delicate but precious structure in the human body. Hence, we try to give the best care for the beautiful pair of eyes.
Pediatric Ophthalmology, children with common disorders like refractive errors, congenital cataract, squint and strabismus.
Diagnosing and treating eye problems in children is an art which requires good clinical skills, patience and most of all a child-friendly atmosphere. At Rajan Eye Care, we treat all varieties of eye problems in children, from simple glass prescriptions to more complicated procedures like congenital cataract, squints and lazy eyes.
Diabetic Eye Clinic and Retina Clinic, fundus fluorescein angiography, FFA and laser photocoagulation, diagnosis and management of retina and vitreous disorders.
We at Rajan Eye Care are involved in diagnosis and management of diabetic retinopathy at various stages. We have all the latest equipment available across the globe, and also not only the equipments which are available for the screening and detection of diabetic retinopathy, but also equipments required for treatment in form of lasers, newer injections which goes into the eye and treat the blinding disease, and as well as latest surgical equipment which are required for this advanced kind of diabetic retinopathy.
Comprehensive eye checkup. This includes eye testing for spectacles, refraction, measurement of intraocular pressure, and complete retinal examination. Contact Lens Clinic, therapeutic and cosmetic contact lenses, including the availability of Premier Rose Scale lens. Glaucoma Clinic, applanation, tonometry, and computerized automatic visual field analysis, fields, and optical coherence tomography.
Glaucoma is a disease where there is increased pressure inside the eye. It is a silent thief of sight because the patient does not experience any symptoms in the early stages. Vision loss occurs slowly and is irreversible. So it is important to diagnose and treat glaucoma in the early stages to prevent vision loss. At Rajan Eye Care, we have sophisticated equipments to diagnose and treat glaucoma.
In-house optical, having indigenous and imported frames to select from. Trauma Center, 24-hour ocular trauma services. The hospital takes its rich expertise and experience into the classroom by offering the following courses. Postgraduate training courses for Diplomate of National Board, affiliated to National Board of Examinations, New Delhi. Short-term fellowship in microsurgery, phacoemulsification surgery training programs, fellowship in optometry and ophthalmic nursing assistant course.
Postgraduate Institute of Ophthalmology, which is training people or students after their MBBS in the Diplomate in National Board, affiliated to the National Board of Examinations. We have also the fellowship in optometry. As you know, optometry is a course which is done by students who have passed out of the 12th, and they are mainly trained in checking the glasses and also the basic ophthalmic procedures.
Apart from this, they play a vital role in the community service through Chennai Vision Charitable Trust, Netra Vahana, an advanced mobile eye clinic equipped with some of the latest diagnostic and therapeutic equipment, which is a part of the Chennai Vision Charitable Trust, was established 21 years ago with the aim of eradicating curable blindness in rural Tamil Nadu.
The community ophthalmology wing of Rajan Eye Care Hospital, through which we provide free eye surgeries or free eye camps for a radius of 150 kilometers in and around Chennai, taking tertiary eye care to the rural doorstep, the first time in India, through our unique venture which is called the Mobile Netra Vahana, which is being supported by the Cognizant Foundation and Vijay Marthraj Foundation, wherein we have been taking the tertiary eye care to the villages, to the rural doorstep, providing lasers and the complicated eye procedures and very sophisticated technology to the rural areas. Till now, we have done more than 3,500 eye camps, and we have touched 1.5 lakh patients, free cataract patients in these eye camps. We have screened more than 1 million patients in these eye camps and provided spectacles to almost 3 lakh people in these eye camps.
Blind Free India. The campaign is to extend help to underprivileged patients to be operated free of cost. Rotary Rajan Eye Bank. The eyes of the diseased are collected for corneal transplant to bring the joy of sight to that many of those blind.
The Rajan Eye Bank was started in 1996. It's one of the leading eye banks in South India, and till date we have done around 6,000 corneal transplants, most of them at a very highly concessional rate or absolutely free of cost. Corneal transplant is usually done in patients who have poor eyesight because of corneal problems such as corneal opacity, infection in the cornea, or dystrophy in which the patient is born with a problem like a keratoconus or a Fuchs dystrophy. So replacing the cornea can actually restore eyesight completely to these patients.
An eye donation rally is conducted every year at Marina Beach to donate and make a visual difference in the lives of poor people. A multitude of projects are executed for social welfare. Complete eye care service is provided free of cost in the rural parts of Tamil Nadu without any compromise on the quality of service. Overseas tie-up of Rajan Eye Care.
The Rajan Eye Care has got tie-up with the international institutions, and the tie-up is mainly to promote and provide exchange programs between the two institutions.
Equipped with latest technological advancements and a team of well-qualified, selfless and dedicated professional doctors.
At Rajan Eye Care, we believe in quality, we believe in ethical practice, we believe in patient satisfaction. We have miles to go before we sleep. We have a long journey ahead of us, and we want to be the best eye care institution in this part of the world.